As electrophysiologists, we oftentimes have very long cases and prolonged lead time, and so we were looking for a way to take some of that burden off our bodies and offer us the protection against radiation. The two main harms are the radiation as well as the back pain and fatigue. And the zero gravity system has been phenomenal for both those things.
Traditional lead, I think, does a good job in your core readings. What we saw with this system was a reduction to the lens. So even though you can wear leaded glasses and do different things, the way the system is set up does really reduce the operator's exposure, which I think is important, especially with these folks that are doing 10 hours of work a day with fairly high exposure, and we want to keep them in their careers for a long time because they certainly have skills that we want to make sure are available to our patients.
The amount of lead protection that you get with the system is much better protection than you can get with standard wearable lead, and the body fatigue is essentially eliminated.
The physicians definitely saw a reduction in their exposure to radiation. It also allowed them flexibility in being able to move around the procedure table.
We had sampled some other systems, and the zero gravity just seemed the most natural. It was less, it interfered with the case less, the operations of getting access and manipulating catheters. I felt less encumbered by this system than other systems. So, obviously we're a pretty high volume center here. We do about 900 ablations and about 1,200 devices a year. So the hospital was very willing to get a system that would allow us to continue at that level of productivity or even increase it. They have a vested interest in our longevity and our ability to remain injury-free.
Certainly, physicians are a big part of our success in our electrophysiology program and in any program that you're offering to patients and to your community. So I think it's a commitment to them and to maintaining their practice for as long as they choose.
I could feel like I could probably throw on another case in the day because I'd have less fatigue and body aches from wearing the lead.